Hi everyone, this is Dr. Stefan. In this video, I'd like to talk a little bit about chest pain because it's a very common symptom and many patients really worry sometimes that chest pain is something really serious, and in some cases it can be, but also sometimes it may not be what you expect because there are so many causes of chest pain. And if you think about the chest, it contains many organs. So it can contain the heart, the esophagus, the lungs, there's the pleura, which is the lining around the lungs. There is bone tissue and muscles and all kinds of things that can potentially hurt. So that's why I want to talk about chest pain in this video. So let's start by saying that the lungs themselves, the tissue, the spongy tissue of the lung, that one doesn't hurt. So it doesn't have the right nerve endings to cause pain. However, the lining around the lungs, which is called the pleura, that can hurt. So that can have nerve endings, and if there is inflammation in the pleura, for example, or if there's any injury to the pleura or any sort of infection potentially affecting the pleura, or if there's fluid around the lungs, you can get chest pain. So the chest pain in those situations does not originate directly from the lungs, but from the pleura. Let's move on. The esophagus. The esophagus is the pipe that leads from the mouth to the stomach. So it just goes down. Now, the esophagus has smooth muscle, and the smooth muscle can sometimes constrict and spasm, and that can sometimes cause an episode of chest pain. Or someone may experience acid reflux, so acid coming up from the stomach into the esophagus. Reflux may irritate the esophagus and cause heartburn or chest pain. So that can sometimes be, it's called heartburn because it can be confused sometimes with heart pain because it occurs here. The next thing I would say is the airways. So if you think about the airways that go into the lung from the mouth, nose, there's the windpipe, and it branches out into the lungs. Now, if there is an acute infection, inflammation, you've been coughing a lot, you may feel a little bit of a burn here, and many people have experienced this during an acute episode of bronchitis, for example. You've been coughing a lot, you may feel a little bit of discomfort here, which may be interpreted as pain. So that can also be one cause. Then let's think about the heart. The heart obviously can cause pain. So people who suffer with angina, which is a symptom related to ischemic heart disease. So when the coronary vessels, which are the blood vessels, the arteries that feed the muscle of the heart, become narrower due to plaque deposition, cholesterol, other things, or may spasm for some reason, it can cause chest pain because the muscle of the heart is not getting enough oxygen. So the reaction is to have this pain. So obviously that can occur in episodes which may be related to exerting yourself beyond a certain threshold. If you have stable angina, it can occur out of the blue. And if the pain is really, really strong, people need to rule out generally a heart attack. So this is again one of these instances when you get a strong chest pain, usually around here. It's a crushing pain, very strong, very strong. It can irradiate down the left arm or into the jaw or into the upper part of the stomach here. So it can be very, very strange, this chest pain. It can also sometimes be associated with a sensation of nausea. So some people experience angina or heart-related pain in different ways. But it's really important to recognize if there is a very strong pain in your chest, probably you need to go and see what it is. The other cause of pain, which may be related to the cardiovascular system, but which is fortunately very rare, is when people may experience an aortic dissection. And this is again one of these episodes when there is a strong pain. And it relates to the big vessel leaving the heart, the aorta, and the lining of the aorta detaches a little bit. And it's something very serious. It needs to be treated in hospital. It's usually accompanied by very strong chest pain. So again, this is one of these other things. Now, just coming back to the area around the lungs. Sometimes I mentioned that the pleura can hurt. Sometimes if there is air around the lungs, because of an accident or because there is a small perforation in the lung that leads to an air leak and then air builds up between the lung and the chest wall, that is called a pneumothorax. And that again is an instance when chest pain may occur. So again, related to the pleura. Moving away to the chest wall itself, we need to be conscious that we have ribs, we have intercostal spaces between which there are nerves, there are muscles. All of these can actually become constricted. You can have irritation in some of these areas. Some people may have herpes zoster infections where the nerve is affected by this herpes virus, and usually there's a little bit of a rash following one of the intercostal spaces. It can be really painful. Again, many people may consider that as chest pain. So again, muscle pain related to the bone, the cartilage, the muscles, it can happen. The final thing I'd like to say is to think about the spine. Right? So the spine is again something that's really common in cases of chest pain. Many people who are like me sat down at their desk right now, you're actually putting a lot of strain on your back, on your spine, because you need to support your entire torso. So obviously when you're sitting down like this, your spine needs to support your upper back, your head, which is bobbing forward a little bit. So this is an uncomfortable position for your spine. And with time, if you spend days on end at your desk, because of your work, and everyone's doing computer work these days, you may start to experience a burning or painful sensation right here in the back, in this area. And many people do worry sometimes that that's actually related to their lungs or something else because of the location of the pain, which is in the back, and people think, well, it's the lungs. It must be the lungs that are hurting, and actually it's the spine. And usually correcting your posture and doing exercises will help with that pain. So this is a little bit of an overview. Just wanted to tell you that indeed there are many causes of chest pain. I probably haven't included all of them here. There could be others, but it's really important just to remember this takeaway message. If you suddenly experience very strong, crushing, powerful, very, very strong chest pain, do seek medical attention, see what the cause is, and try to see if there's anything you can do to improve that, just to not miss anything dangerous. Hopefully this was helpful. If you have further questions, leave them in the comment section below, and I'll see you in future videos. All the best.